those that are maybe unfamiliar with the topic, what exactly are orthobiologics?
Yeah, it's a great question. So, orthobiologics really refer to a specific group of biologic therapies that we usually use to treat musculoskeletal conditions, usually intra-articular and sometimes extra-articular pain and musculoskeletal conditions, whether acute or chronic. And, when we talk about biologics, we have other things, I guess, that could be classified as biologics now, like maybe even like those monoclonal antibody type medications that we see on so many of the TV commercials now that end in the MAB or the MAB for monoclonal antibody, which is one of our new, our newer generation of prescription medications that we have could be considered biologic therapy or biologic type of medications. But with orthobiologics, it's specifically, we're talking about its a use being applied for orthopedic and sports medicine type purposes. But to clarify, the interesting part of that is there's some crossover with these products when it comes to aesthetics. And we can, talk about that as well. But, for orthopedic purposes, they include things like PRP, which is platelet-rich plasma. Some will use what they call platelet-poor plasma, or PPP. And then you have protein concentrate, which is basically concentrated plasma, where the several different kinds of proteins are concentrated in that particular product. And then you can also have bone marrow aspirate concentrate, and some will also use adipose, whether micronized adipose, basically mechanically separated adipose tissue as well. And hyaluronic acid, which a lot of people are familiar with, can also technically be included, I think, as an orthobiologic. And there's also a lot of people in the regenerative medicine field that will use prolotherapy as well, which is various mixtures, usually of like dextrose and lidocaine. So when we talk about orthobiologics, it's really, plasma, platelet-rich plasma, protein concentrate, bone marrow aspirate concentrate, adipose sourced stem cells, and then, there's energy devices now that are also becoming very popular in regenerative medicine, which aren't cellular and aren't from people's bodies. They're not biologic, but they're treatments and devices used in treating patients in conjunction with the orthobiologic therapies.
Interesting. What types of musculoskeletal conditions typically respond well to these type of treatments?
Yeah, so we see a lot of knees in this field, probably followed by maybe shoulders and backs as well. Those are probably the three overall most common areas. We see a lot of patients, with your standard knee arthritis, osteoarthritis, or degenerative joint disease, or maybe they have some meniscal damage or meniscal loss as well. But it tends to be, the areas of our bodies that don't have a good blood supply, right? So a lot of people will ask, what's the magic here? And, how does this stuff work? If my body has all these great things in it already that can heal me, how come my knee is falling apart and not healing? And the answer to that is really twofold. One is that, certain parts of our body, particular intra-articular inside of our joint space, doesn't have a good blood supply. And so it's hard for the things that our body needs to detect problems and send things there to fix them to actually be able to do that, versus if we get a cut on our skin, it has a good blood supply, so it heals. It's a little bit different inside of our knee joint. And so the other aspect of regenerative medicine is getting rid of things in our blood that we don't want to use, and trying to concentrate or keep the things that we do want to use. And our bodies can't do that on its own. It does not have a built-in, person that's in there with a centrifuge that can, process blood products essentially. And so when you combine that with putting a product where it can't make it on its own in a concentrated form, that's really what the magic of regenerative medicine is. It's helping people use their own body to heal itself.
Amazing. Most people that see you, it's because they already tried the regular way, right? Or do you get people that have never tried to go to a regular doctor and they just right away try this?
Yeah, we see both.
Okay.
So we will have patients that show up where it's their first stop, and they haven't gone through the traditional pathway, and they even if they've had the problem a long time, and some of them, more people now are just some will shy away from going through the traditional because they already know that they don't want to take a pain medication, or they don't want to get a steroid injection, or they don't want to get surgery even if they're a candidate.
Right.
And so they'll look for alternative therapies, TENS units, acupuncture, massage, chiropractor, and those things are great too. There's nothing wrong with them, but a lot of patients will come to us and they've already tried those things, and we really try and explain to the patients whether they haven't tried anything else and where regenerative medicine might be their first stop, or they've sort of been through the system and tried a lot of things already. It's important to educate the patients. The big part of what I do is explaining to people what their options are to manage their condition. Say if whatever that may be, it's really always the same options, right? It's one, do nothing. And in that case, the problem is most likely not just going to get better on its own. Most likely it's going to gradually continue to get worse. The second option is to do medications, which either people just want to avoid completely, or they've already taken medicine and it doesn't work, or they're on a lot of medicine already and there isn't much else to add and it's not enough. And then you have alternative therapies, as I mentioned before, like topical things and herbal supplements and massage therapy or chiropractor or whatnot, and that's fine. But usually that's not enough to get patients where they need to be in terms of pain control. And again, it doesn't always eliminate the underlying issue. You then have surgery, and again, most people are coming because they're trying to avoid surgery, or they've had surgery already and it didn't work for them. Or maybe they have had surgery before and it kind of worked out okay, but they're trying to avoid general anesthesia or the downtime associated with it, and want to try something different. And then, unfortunately, once somebody gets, say, a full knee replacement and they put all metal in there, regenerative medicine is then off the table. They can't then do regenerative medicine after that. All they can do is really more surgery. And so that's why we always try and urge patients to try this first. And some people will say, well, what if it doesn't work for me? Because there is a percentage where maybe in about 10 to 15% of patients it either doesn't help them to the degree they had hoped it would, or it doesn't help them at all. They just didn't respond, because we don't know how everybody's going to respond. And I always try and tell people, there's still value, even if you had paid money to have these types of treatments and it didn't work for you. At least that you have no other option. Or basically, right? Like you're either going to have to go get surgery, or you're going to have to take medication, or both, because you know what your options are and you've tried everything else essentially. And so, hopefully, for most people, regenerative medicine works. But for those people who unfortunately it doesn't, at least they know that they can make the best decision for themselves because they know what their options are. They've tried everything else. And so they can be comforted in knowing that they have to perhaps get surgery for their condition.
And as per my understanding is that there are a lot of issues that you cannot even do anything in a surgery?
Yeah, I mean, there are conditions that are just, patients that can have a bad condition, but they might not even be an operative candidate. It's
Right.
not to say surgery couldn't potentially help them, but when I say non-operative candidate, I mean I'm not a surgeon, but those are cases where the surgeons feel, it's too high risk, or there's not a great chance of a good outcome, or it could be risky for the patient, or there's not just good evidence to support that surgery is going to help them in the long run. Because surgeons also have data and do research, and they like to, outcomes are important to them as well, and they want to make sure that the types of surgeries they're doing also make sense and are helping people. So people in regenerative medicine, certainly, there can be this misconception that we're against surgeons or patients going to get orthopedic surgery. And that is not the case. There are unfortunately some patients that we have to turn away. Not that we want to. We want to help them, and in some way we still do, even though we're not able to treat them. They're coming in, and where I work, we don't charge just for an initial evaluation to come and talk. But there are cases where it might be their first stop, and they don't know any better, but they have a condition that is surgical only, and we can't help them. And maybe we help them with the diagnosis, or make the diagnosis for them and guide them and say, hey, this is what we think you have going on, and we can't help you, but here's what we think you need to do and probably have done. And so we really just want to help people make the best decision, regardless if they choose the regenerative medicine route or want to go the surgical route. But for instance, someone with a full rotator cuff tear, where they've completely torn, they have a complete full tear of their rotator cuff to the point where they cannot move their arm at all away from their body. It is just so bad. That's not to say that doing regenerative medicine couldn't work on that patient. It's just not very likely, and that patient, we know, is more likely to get function back and benefit from surgery, just because we have more data and information on that. So that wouldn't be a patient where I'd be like, oh yeah, let's try this regenerative medicine. We have a pretty good likelihood we think this is going to work for you. That's one where we say, well, there's a chance regenerative medicine could work for you, but really it's kind of like rolling the dice, and we really don't know how great the odds are. But we know that a lot of people who do this go get surgery, and they're that helps. So go get surgery. There is also times when doing regenerative medicine can help after a surgical procedure, after somebody gets it, and there are some surgeons that will actually use orthobiologics intraoperatively, where they will be doing a surgery, but they will also inject, platelet-rich plasma, or perhaps bone marrow aspirate concentrate in there, or maybe some type of cellular or biologic graft as well.
Okay, and talking about patients that you sometimes don't, that you tell them that they're not the right fit. What's the typical patient journey? So from the first consultation to defining what the right treatment for them is, if they have a right treatment with you.
Yeah, so the first step is sort of determining what. Well, I guess it would be you have you come in for an appointment, right? So part of regenerative medicine is getting the word out, and people need to know what this is. And a big part of that is radio, television. Word of mouth is also very important, and people who've gotten treated telling their friends and family, of course. But somebody's going to have a condition, they're going to hear about a regenerative medicine practice, in their area, perhaps, or know a friend that got treated with regenerative medicine somewhere in their area, and they're going to schedule an appointment because they've been dealing with this pain, and they're probably thinking in their head that it's probably a surgical issue, or maybe they already know what it is, and they don't want to get surgery, or they don't want to take pain medicine, and it's affecting their quality of life to the point where they have to do something about it. And so they would then come in and, hopefully have imaging with them, meaning, if they've already had an x-ray or an MRI before, great. Take a look at that. If they haven't, it really depends. There are some cases where imaging might not be 100% necessary. If a patient has an exam and a history consistent with just osteoarthritis of the knee, and there isn't any other findings that would suggest something else, you don't necessarily have to go and get an MRI on that patient's knee to say, oh yeah, they have, arthritis in there. But in some cases, it's very important to get imaging, especially if there could be something else serious going on that may not be, a musculoskeletal condition, but something else. It can be important to make sure that you have updated imaging. Somebody had an MRI of their knee, 3 years ago. It's probably not necessary to go ahead and order, another one. But if they've never had one before and their presentation's like very abnormal or something like that, we're gonna say, hey, we really think it's important that you go and get, imaging done, and then we'll sort of go from there. So once we sort of know what's going on with the patient and what their condition is, then we basically determine if we think the patient's condition would benefit from regenerative medicine. Like, does what they have, is that going to be something that we think they're going to respond to, where we've seen other patients with similar conditions respond before? And then lastly is, are they a candidate for the treatment? Meaning, is there any contraindications or reasons why, whether that might be a medication that they're on or another medical condition that they have, where there's certain biologics we wouldn't use for them, or a reason why we just wouldn't be able to treat them at all. But if they have we know what the condition is, and we think they could benefit from treatment, and we don't see any contraindications for treating them, then, the only other hurdle is, being able to afford the treatment. And then after that, it's, basically signing consent forms, getting your blood drawn, and, starting your first treatment.
Does insurance at all work with this type of treatments, or not at all?
Very little. It's trickling in little by little.
Yes.
And what I mean by that is 5 years ago would probably be a hard no, like absolutely nothing at all. Now there are patients who have done okay using HSA accounts for these type of treatments. There's also been some patients that have had some of these newer sort of more private insurer types that aren't necessarily connected to the traditional insurers, and there has been some patients who have been able to get some reimbursement from these treatments using some of those newer sort of, I guess, I don't know what the right term is, I guess alternative healthcare insurers or whatever. And then fortunately now most people are able to afford these treatments because of financing vendors, right? So there's sort of like two issues with regenerative medicine in the past. One was, patients didn't have access location-wise, meaning you had to travel very far or go to like a tertiary center or somewhere to get these types of treatments. And, also they were very expensive. That's why, you'd see celebrities and famous people getting these. But a lot of other people know because it's not covered by insurance and it costs a lot of money. But when you have financing vendors, you can then, pay for these kind of treatments just like you're making a car payment. But instead of doing it for 5 or 6 years, you're only making a car payment type of thing for maybe 6 months or a year or a year and a half to be able to, avoid surgery. I think over time, more insurances will eventually start paying more. I think the VA will pay for like 1 PRP injection for knee osteoarthritis. And, it's kind of a little bit of a double-edged sword with insurance, to be honest. It's a good thing because it might help a little bit more patients be able to get the treatment that can't get it now. But at the same time, with insurance coverage could come more controls for medical providers in what they can do and how they can use these to treat patients. And in some cases that could be good, in some cases that could be bad. There's pros and cons there. So, insurance coverage is wanted by patients because they want to have these treatments, but they don't want that money to have to come right out of their own pocket. But at the same time, there could be negatives associated with insurance coverage as well.
Yeah, and that's exactly what you mentioned at the beginning, that's why also a lot of people are even traveling to other countries, and it's probably not because the talent is not here, not because the options are not here, but just because there's a lot of rules and regulations around it.
Yeah.
Correct.
Yeah, that's a great point. So there's actually other countries that many here feel are maybe ahead in certain areas of regenerative medicine than where the United States is, and that is just because, as you said, there's less red tape in those areas, and sometimes we might restrict ourselves more than we should when trying to advance. But I would say that there's some big players in the industry that certainly affect regenerative medicine in terms of how fast it's advancing, and those would be the pharmaceutical industry, CMS or Centers for Medicare and Medicaid, the FDA, and then large hospital corporations. And some of those work together, like CMS and the FDA, for example, or the pharmaceutical industries and the FDA. But for various reasons, regenerative medicine can be disruptive to those industries.
Yeah.
And so while, they may want to, slow the train down with regenerative medicine, so to speak, I don't think that the train's going to stop just because this is, part of the next wave of healthcare and medicine. And a lot of people understand that it can be financially disruptive to those other industries. But at the end, and they're trying to minimize that by just a slow rollout of regenerative medicine. But at the end of the day, this is a very low risk, low adverse event type of treatment that really helps people without the negatives of a lot of the other options. And as a medical provider, it's really hard not to want to see that to continue to advance, as long as, it's done safely and not, just haphazardly or whatever. But we have so much data and evidence to support these treatments now that, so many providers have been using it for so many years now, that it's just frustrating.
Yes.
Because medical providers know how well this works and helps people, and we just need to get everyone else on board.
Also very frustrating because I know that chronic pain, a lot of people struggle with it. I think even numbers of people, it has been growing more and more with, I guess, people being more in their computers or more stress. It's a lot of people are affected by it, and it sucks. These huge companies that they are against progress that can help so many people.
Yeah, I mean, these types of treatments can help either get people off of pain medications or keep them from getting on in the first place. One of the best cases that I had, and that's because I have some experience with opioid. Treating patients with opioid addiction with, Suboxone and medication-assisted therapy, and also treating patients with chronic pain with opioid pain medications and Suboxone as well. And, if we can get patients to never have to start taking a medicine like that in the first place, I feel like that in itself is a win.
A win for everybody, especially because of the big crisis there was with, and well, and there still is with opioids. Okay, for how do you set expectations out with like for results with your patients?
Yeah, it's another great question. So part of it has to do with what I spoke about earlier, and that's with setting realistic expectations up front with the patient and explaining, hey, we can't promise or guarantee that this is going to work for you. And if it does work for you, we don't know where you're going to end up in the end. We don't have a crystal ball. Like you could be 50% better, or you could be 80% better, or you could come back and 3 months later and tell us your pain is 100% completely gone, and you tell everybody to go and do this because it's so wonderful. Um, but so that's very important. It's important not to mislead patients and to say, yeah, these treatments can do this and that, and we've seen this and that in other patients, and we've seen this happen, but we can't promise exactly what's going to happen for you or guarantee, where you're going to end up. The other part of it is everybody's pain level perception could be different as well, and all of our bodies are different in our perception of pain and how they respond to these treatments. And so we'd just be guessing and not being honest with patients if we try to come up with something to tell them. And so I only tell them what I do know and what I can tell them about how long the treatments last, how long they can expect it, how long does it take to start working. Those are very common questions. And then, what if it doesn't work for me, which I spoke to earlier. And when it doesn't, I just talk to the patient, like we're talking right now about these treatments, and hey, we want it to work for you. That's why we did it. We didn't think it wasn't worth doing up, otherwise we wouldn't have. We would have said, no, we really don't think you could benefit from this, or there's a very low chance. Now there are cases where the provider feels like it really is a tough call, meaning the provider doesn't want to be overly confident about saying, yeah, I really think you should do this treatment because it's a no-brainer, like this is a slam dunk case kind of thing. There could be some where the provider's like, hey, with what you have going on, there's this non-operative condition. It's very severe. There's some providers out there that wouldn't even treat you because they don't think that, you get enough benefit from it or to respond. I might be willing to treat them with the understanding like, hey, this is rolling the dice. It's a shot in the dark. I don't know what your odds are. It could be only 10% or 15% chance or something that this could help you, or 20%. But I really want the patient to make the decision for themselves, because again, I go back to those options and what their options are, and leave it up to them on what they want to do for their body. If they're willing to spend the money to try it out, knowing what the risk benefit ratio is, then I don't want to keep people from doing that. I don't want to prevent them from trying and restricting and saying, no, I won't let you access this treatment, basically. But at the same time, on the back end, if it doesn't work out, I want them to know, like, not be upset with me as the provider. And again, that's why I'm very transparent and don't want to do anything misleading with patients when it comes to talking to them about these treatments, because it's so important. Yes, you'll get the patients that they're doing backflips and they love it, and there are things they weren't doing before they're doing now, and they think this is the best thing ever. Right. And then we get patients that are like, I don't understand how other people get better from this, and this did absolutely nothing for me, and it was a total waste of money, and so forth. Or my pain's the same, or maybe even worse than it was after the treatment, because of course they're a little bit older and time goes on during their treatment, and are just very unhappy. But I can empathize with them as well. Even if they don't at the time, they don't want to hear the, okay, well, it wasn't a total waste of money because I know what my options are. They don't want to hear that because they're in pain, and people in pain that maybe don't always think rationally. And when I was in very bad pain, it was the only thing that was on my mind that I could think about. And people forget where they started when they get these treatments, right? Some of them will forget that how bad they were. Maybe they still have some pain, but they forgot that like they couldn't drive before, or were using a walker or a cane, or couldn't do this or that. And now they're able to do those things, but maybe they still feel a little something there. And you have to remind them where they were when they started, because once the pain's gone, your body sort of eventually moves on, and you forget how bad it was, and that it was something you were so focused on, and that was such a part of your life because it was interfering so much.
Exactly. What are the biggest misconceptions that you see around these type of treatments?
Yeah. So that we don't see too much of this anymore, but there was the stem cell misconception. I guess from back in the '90s era, where some people were misled to believe, and this is not how regenerative medicine is done, of course, these days, but that fetuses are being used as a source for stem cells, and that is not the case. Our everything that I treat patients with orthobiologics these days comes from them, so it's coming from their whole blood, whether that's or their bone marrow, whether that's PRP or protein concentrate, and then bone marrow comes from their bone marrow that I take out of them, and so there's nothing that comes from anybody else, and it's not. There's also another misconception with like stem cells and cancer too, where patients will ask about that. That has more to do with not properly knowing how to use stem cells for intravenous purposes, where there can potentially be some risk there. But when it comes to, say, getting your own bone marrow taken out and having that processed and then injected back into your knee the same day, there's no kind of risk of cancer with that. The rest of the misconception, I think, just has to come with a lack of knowledge that the general public, but even some still in our healthcare system, have about these treatments, where it's snake oil, or it's not real, or it's not based on research, or there's no evidence, and whatnot. I think a lot of that has to do with people, especially medical providers, when it's something that they don't know about or understand. There can be a tendency to put it down, or be disinterested in it, or oppose it, because they don't have an understanding of it, and so I think that could be part of it. And also, people are just geared towards expecting what they have gotten in traditional medicine, which is things being done to them, right? So that's tests being ordered on them, medications being prescribed to them, and surgery being performed on them, right? Like, those are the three sorts of things that people really think healthcare and care is, right? And so this new thing where you come in and we take blood out of your arm, and then 30 minutes later, we're putting something in a syringe into the part of your body where you have pain, and we ask you for all this money, and you go on your way, and we tell you it's going to work, and we think you should do good, and we're crossing our fingers for you, but we don't actually know. It can be challenging, and the hard part of this is patients. They have to be patient, because this is not an overnight thing like a steroid injection or medication. It's a biologic process, and one of the hardest things for patients to deal with, other than the money aspect, is the having to wait to see where they're going to end up and what the treatment's going to do for them.
Correct, because that's what they think with like a pill. Right away, you're gonna feel something, or the steroid injection helps you right away, but only for a couple days. Like that doesn't like that's not 100% your cure either way. Um, so yeah, I think it's very important to be patient. Like this is like chronic pain. I think teaches you that patient with everything. So it's anything that you can try. You need to be patient and also be very because what you were mentioning, like people they don't realize how bad they were before, but maybe you're at a point where it still hurts, but now it doesn't hurt like the whole day, or it
Yeah.
only hurts an hour a day, or only when you are too long in the computer, but then the weekend it doesn't hurt. So that's
Yeah,
what people
I think if there can be an improvement
yeah.
in the patient's quality of life to some significant degree in the provider's mind and in the patient's mind, I think that's a win.
Yeah.
We, of course, the goal is to get everybody 100% free, but we know that's not realistic, these days. But some patients are really grateful. They might not get 100% relief, but there could have been something they couldn't do before that now they can, or their pain was such an interference before that they just couldn't function, and now it's to a reasonable degree to where they feel like they've gotten their life back, and that's a win too. And so yeah, there's variability with that, but you know what? There's variability with surgery too. So you can have 10 patients and they all go and get total knee replacements, and some of them might do really great, and some of them might do okay, and some of them might not do so good, right?
Correct.
And even with medications, some people could go on a medicine and do well with pain control on that medicine for 10 years with no adjustments or something like that. And then you can get someone else where you go on it and in 6 months you're on 3 different medications at the max dose and you're still in pain all the time.
Yeah, correct. Okay, what's been the most effective way for you to educate people around this field?
Yeah. Well, there's seeing patients in the clinic and educating them. They help spread the word sort of for me, right? Because I'm telling them, and then they're hopefully, undergoing treatment, and then hopefully having a good response, and then going and telling everybody in their life that they know that has pain, hey, like, I tried this, and here's how it was for me. And that at least gets patients to know, it's one thing to have even a medical provider say, hey, these treatments are this, or, you hear it on the radio or whatever. But, when someone has a close friend or family member that they know and they've seen in chronic pain, and they get a treatment done and they see that it positively affects their friend or family member and that they're better, that holds a lot of weight with other people really believing in the legitimacy of what these treatments can do for people.
And apart from word of mouth, is there any marketing strategy that has worked well for you, or that's the best one and that's the only one you do?
Yeah, so I think for a lot of regenerative medicine, probably radio is very important. Now you can still miss people with radio. There's some people that don't listen to the radio at all, or and then you have satellite and terrestrial and AM and FM and so forth, and then you have digital marketing, billboards, and television, for example. I think part of the hard part with getting the word out also has to do with getting the word out for other providers. I think I was trying to say earlier that a lot of medical providers also don't know about regenerative medicine either, and they're not really teaching it in medical schools.
Yeah.
No residency training programs for regenerative medicine, and so that's another whole topic and area. But both people in need of these treatments, non-medical people, and healthcare providers both need to have education about these treatments. And that's one of the reasons why it's important to, um, like why I like to be able to educate patients for free, whether they decide to do the treatment or not, so that they can tell other people and they have the information. I think that's very important. Um, but the marketing has been also limited and restricted also because of what's been allowed and not been allowed to be said in marketing about these. If you go back a few years ago and you used the term stem cell, maybe in a radio commercial for a regenerative medicine practice, you could potentially be getting trouble for such a thing. But nowadays, for instance, it's a little bit more less hardcore, restrictive on that. But so you have to be careful with really explaining or saying so much of what this is. And then the other part is like, in a radio commercial or even a TV commercial, like you don't have time to explain to somebody like what platelet-rich plasma is and does, or what protein concentrate is and does, or bone marrow aspirate. They just need to know that we're a place that doesn't look like a traditional medical thing, and we treat patients that have pain conditions, and that's about what you're doing with the marketing. It's like, hey, do you have pain? We treat pain, and we do it without surgery and medications, basically. Right? But they don't necessarily know what that means, and so it has a pain management connotation to it, right? But regenerative medicine isn't really necessarily the same thing as pain management. And a lot of people, when they hear pain management, they think of, getting pain medication prescriptions, or maybe getting other procedures like, fluoroscopic guided, injections, maybe epidural injections, or, guided steroid injections, or whatever it may be. So, and sometimes for some people, those things can have a negative connotation because they hear pain clinic and they just think opioid epidemic, right? Like that's how they equate those things. And so I always try and tell people, we're not really, I don't like to think of it as pain management. Even though that's really what we're doing, I like to think of it as regenerative medicine, just because I feel like the future of regenerative medicine is going to be so much more than just the pain management aspect once we start getting into, IV cellular therapies that cross all kinds of specialty lines.
What advice would you give doctors that that they're looking to grow their practice on a niche area like this?
Yeah, I think the most important part is a lot out there might want to get into regenerative medicine, and stem cell has been a hot term for a while now. More people know about it, and athletes have been getting these treatments for a while now. But it's very important to know the regulations first, the law and the regulations surrounding regenerative medicine, and what you can and can't do, both on a federal level and maybe in your particular state as well. You don't want to just go out there doing things and not really have the foundation and knowledge of what you should and shouldn't be doing. It's one thing to advance medicine and be a pioneer and be on the cusp, and it's another to just not have the education to at least be aware and know where you are in what you're doing. So I think that aspect is important. The next is knowing what quality is in the industry, and what I mean by that is some of the products needed to make and create orthobiologics, right? So we take out whole blood, but there's things that happen in between that are needed to make the final product. And those in-between things, those products, their quality are very important, and how they're processed and who's doing it makes a difference and is very important. So that would be the next step if you want to get into this, is knowing what the quality products, kits are out there to process orthobiologics, know what the law and the regulations are, and then read some research, and then figure out how you want to sort of deliver regenerative medicine in your practice. Whether maybe you're a family practice physician and maybe you want to start out just offering one type of orthobiologic to only patients with a knee problem or something, and eventually you want to expand. Yeah, I mean, and then you have to have the right facility and the right equipment. It depends if you're trying to build a new clinic from the ground up and you just want to do this, or just add it to an existing practice. But you're talking about having to have a little bit of a lab space, and medical assistants or staff that draw blood and know how to handle blood and process blood products. But that's about it. It's a passion for doing this type of medicine. Obviously, if you don't have a background in sports medicine or physical medicine rehabilitation or orthopedics, there's could be some self-education needed on learning more about just different orthopedic conditions and injuries and proper management and things like that. So obviously that's important. And that's pretty much it. And then, dealing with the financial aspects of how you're going to manage that with, patients, and if you're going to work with financing vendors and those types of things.
Got it. How do you balance, this is the last question, how do you balance being a medical expert with the demands of also running a business and marketing a business?
Yeah. So they go hand in hand. I think maybe in the past people didn't necessarily look at healthcare as business, but probably more nowadays people realize how much business and healthcare are tied together, especially with cash-based medicine, where the survival of the business and the clinic is dependent on basically running a business and having revenue and being profitable. And some people, unfortunately, frown upon that and are like, "Oh, you're just making money and you're just selling." But we became healthcare providers to help people. And at the end of the day, if we can't keep the lights on and make a living and pay for the equipment and teach and do research and go to conferences and whatever it may be, if we don't make money to be able to fund those things and do those things, then we won't be able to ultimately deliver these treatments to people. So at the end of the day, it's really all about being able to treat people with these. And in order to be able to do that in the system that we work in, we have to be able to survive as a business. And the healthier we are, the more people we can help and reach at the end of the day.
Exactly. And then it has to be a win-win situation, both for the patients and for you. And that way you guys can help even more people.
Yeah. So the motivation is really trying to learn how to get patients on board with trying these treatments out, with that big elephant in the room of it costs money. And that will lead to, hopefully, as you're helping more and more people do this, and they're telling everyone how great it is, will lead to a successful business if it's run properly. And the goal, again, is the more successful the business can become over time, that means that perhaps, prices for these kinds of treatments can come down for patients, and it doesn't have to cost as much. And there could be more volume. If more patients come and do these treatments, if twice the amount of patients came to do these kinds of treatments, we could maybe cut the cost in half,
Exactly.
right?
Mm-hmm.
Make it even more affordable.
Dr. Garzone, where can people find you?
Where can people find me? So I am available via email pretty well if anybody has questions for me. I do work in clinic, seeing patients sometimes. However, where I am working in clinic, like what location, can vary. But my email is just my first initial and my last name at hotmail.com. So jgarzone at hotmail.com.
Okay, and that's the best place, or also what about social media? LinkedIn?
Yeah, social
That
media,
too?
LinkedIn, is really probably the only social media I'm
That you
active
have?
on in
Okay.
any way. I do have an Instagram account, but it's literally for me to follow some other vendors and businesses. I don't post anything, and
Mm-hmm.
I'm
Not
really not
active.
on it. But my LinkedIn profile, you should be able to find me under Justin Garzone or Justin Michael Garzone.
Awesome. Perfect. Okay, well, thank you, Dr. Gerson. This has been a very, very awesome conversation. I appreciate you taking the time to share your experiences and all your knowledge. Is being very insightful for me. I learn a lot. I'm sure people are going to learn a lot if they hear this conversation. Apart from that, I just quickly wanted